call tomorrow and he'll be coughing and he has COVID and there's nothing I can do.
11 Investigates broke the news when this Westmoreland County nursing home started to bring in COVID-positive patients, even though the facility had been COVID-free. Now, that was almost 2 months ago, and tonight, more cases and new concerns at Bel Air Nursing Home in Lower Borough. 11 Investigates' Angie Moreski joins us with new information on employees testing positive, and the families are worried that their loved ones are now at increased risk. So, Angie, what can you tell us?
Well, Lisa, I've talked with family members and employees who say some staff are working with both COVID patients and non-COVID patients, increasing the risk of crossover infection. It's something Bel Air's owner, Guardian Healthcare, said it would not do when 11 Investigates broke the story about the COVID unit being added, but now the company confirms it is happening.
All right, love you.
Stacy Williams visits her dad every day through the window at Bel Air Nursing Home, but now worries her 67-year-old father, who is wheelchair-bound, is being put at added risk of contracting COVID because some employees care for both COVID and non-COVID patients.
When they're so short-staffed that a COVID nurse is downstairs, they'll bring them upstairs and they can work a double shift upstairs after they've worked downstairs.
There are employees who care for COVID patients one day and then COVID-free patients the next. We also talked to an employee on the phone who asked to remain anonymous, describing the crossover care which violates state recommendations. You've seen where they've had staff caring for COVID patients and in the same day, hours later, caring for non-COVID patients. Complete crossover. Really? Wow. In a statement to 11 Investigates, Guardian confirmed the crossover care, but said there are a small number of therapists who are in contact with COVID and non-COVID patients, adding that they change into appropriate PPE before coming into contact with COVID patients and after visiting leave through a separate exit. But the employee we talked to says that it is more than just therapists. It includes nurses, some who've tested positive. Of those 5 employees who tested positive, how many had done crossover work from the COVID floor to the non-COVID? 2. Guardian also told us a total of 6 employees have tested positive since the COVID unit was added in July. 11 Investigates broke the news that COVID patients were being brought into the facility and families were not told. What was your reaction to them bringing the COVID unit here when it had been a COVID-free facility?
I was shocked.
Now Williams can't help but worry about her dad and the other residents in non-COVID areas.
It's only going to be a matter of time before the patients start getting infected just like the staff is.
Now, I did send follow-up questions to Guardian, asking them to clarify whether any nurses or nurses' aides have done crossover care, and also whether any of those who tested positive are among the employees caring for both COVID and non-COVID patients. I'm waiting to hear back, but we'll include any updates online for you. Meanwhile, the families tell us they just want to see stricter protocols followed to reduce the risk to their loved ones. Ryan?